Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. This is the high resolution endodontic mode of the lower left quadrant. The area of interest is the lower left first molar. The lower left first molar on the buccal side seems absolutely okay, but on the lingual side, you can see that we have a huge fractured cusp of the distal lingual cusp has been fractured. There seems to be a temporary restorative material, but there is a fracture which is extending just above the crest of the bone. It does not seem to be propagating intraradically or interdentally. Now we're going to show you each and every segment. This is the axial view. On the axial view, as you can clearly see, this is where the fractured cusp is. As we're moving down, we can still see the fractured cusp. You can see the pulp horns, and now we're below the pulp chamber. We're now entering into the crest of the bone. As you can see, the architecture of the bone starting to appear, and this tells us that the fracture has not extended all the way down. So we do see a little bit of a shadowed line here, but that line does not extend to below the crest of the bone, and this gives us the assurance that the tooth does not seem to be cracked all the way down to the apex. We will not classify this as a VRF, which is a vertical root fracture. However, we've got very thin canals in the mesial. We've got three canals total, two in the mesial, the mesiolingual and the mesiobuccal. And we've got the distal canal, which is right here. The distal canal is a single wide canal, which goes all the way down to the apex. On the 75 micrometers, you can see that the mesial canals are very thin, but as we are moving down towards the apex, the two canals join to form one at the apex. Now we're going to take you to each and every segment. This is the tooth on the sagittal view. On the sagittal view, we can see we've got one big distal canal. The approximate working length of the distal canal is 19.7 millimeters, and the working length of the mesial canals, mind you, is approximately 19.5 millimeters as well. If we're looking at the tooth, this is the distal canal on the coronal view. On the coronal view, this is the lingual aspect. This is where the cusp fracture is. This is the buccal aspect, and you can see one wide canal which joins to form one at the distal. And if we move to the mesial, we can see that we've got two canals in the beginning, and as we move inferiorly, we can see that the two canals join to form one at the apex. So if there are any further questions regarding this case, we will be very happy to help. We don't see any VRFs in this case, and this case seems to be treatable with a root canal treatment. So if there are further questions, please feel free. Thank you very much.